Every year, diverticulitis is responsible for over 300,000 hospital admissions in the US alone, and that rate is increasing every year. And here's what's even more concerning. Most patients have never even heard of diverticulitis until they're in the emergency room. And here's the thing, there are 7 specific warning signs that could help you catch this condition early before it becomes a medical emergency. And for many of you watching, perhaps before it occurs again. Now, some of these signs are so subtle that even doctors miss them. Others are so unusual that patients don't think they're related to their gut at all. In this video, I'm going to walk you through these 7 warning signs and symptoms, including one that shows up in a completely different part of your body that most people would never connect to their digestive system. Hello and welcome. I'm Joe Leach, dietitian and founder of Diet vs. Disease, one of the world's largest online gut health clinics. I've seen too many patients suffer because their diverticulitis symptoms were dismissed or misunderstood. So let's get started. Warning sign number 1, pain in the lower left quadrant. So the first warning sign isn't just pain, it's where the pain shows up. And this is where most people get confused. Remember that diverticulitis occurs when diverticular sacs, these are small pouches that can develop in weakened areas of the wall of your large intestine, also called your colon. When these become inflamed or infected, that's when you get diverticulitis. Now, these sacs predominantly appear in the sigmoid colon, this part of your large intestine in the lower left quadrant. In fact, your abdomen can be divided into 4 quadrants using your belly button as the center point. So we have the right upper quadrant. This is where your liver and gallbladder sit. Pain here often points to gallbladder disease or liver problems. We have the left upper quadrant. This quadrant holds your stomach and spleen. So pain here can sometimes be mistaken for ulcers or even pancreatitis. The right lower quadrant, this is where your appendix is. So pain here often raises concern for appendicitis. And lower left quadrant, now this is where your sigmoid colon lives, and that's where diverticulitis usually strikes. So in most people, diverticulitis pain is steady, sharp, and locked into the lower left side of the abdomen. But fun fact, or not so fun fact, research shows that in Asian populations, it's not uncommon for diverticulitis to occur in the right lower quadrant instead of the left, which makes it easy to confuse with appendicitis. The key pattern to watch for is just pain that starts vague, then becomes localized and constant. Because unlike other types of abdominal pain that come and go, diverticulitis pain tends to stay put and gradually intensifies. Warning sign number 2. Fever and night sweats that most people ignore. So here's what you need to understand about diverticulitis. It's an infection, and when your body fights an infection, you're typically going to develop a high fever. That's how your immune system responds to infection. What's really telling is the pattern many patients describe with fever and location of pain. As one person shared with us, I get night sweats so bad I sleep on towels. My lower left abdomen gets hot. Now this localized heat combined with night sweats is your body's inflammatory response to the infection in your colon. Now that said, this was quite surprising. Research shows about 15% of diverticulitis patients are completely afebrile, meaning they have no fever at all or are very much in the high range of normal. Now we've spoken to several diverticulitis patients who had dismissed their low-grade fevers thinking they were just run down or fighting off a cold. So just because you don't have a fever doesn't mean you can dismiss other symptoms, essentially. When you do have a fever, especially combined with abdominal pain, that's a very big warning sign that warrants same-day medical evaluation. Warning sign number 3, bowel changes that seem mixed. Diarrhea and constipation can be symptoms of diverticulitis, but we've seen many patients describe specific patterns that doctors often miss. Now, one patient described their progression like this. It starts as a pain in the lower left abdomen, then the bowel movements start to change quickly, then less and less frequent. Now, I remember they then described a pattern where they were taking multiple trips to the toilet in the mornings to pass stools that just came out, as they described them, rabbit pellets. Another patient described their experience as it's bloating, cramps, little diarrhea alternating with brief constipation. Just all around misery, happens out of nowhere. The key is recognizing when these changes are different from your normal pattern, and especially when they're sudden changes accompanied by abdominal pain. Now, if you've been diagnosed with diverticulitis, or you're worried about it returning, or maybe you're watching this because you're experiencing some of these symptoms we've been talking about, I want you to know that you don't have to navigate this alone. We've helped thousands of people get real clarity on what's happening with their gut and create a personalized plan to address it. If you'd like that kind of personalized guidance, comment Sure Pathway below or tap the first link in the description to learn about our signature For Sure Pathway. It's how we provide concierge, one-to-one help to resolve digestive issues like diverticulitis as smoothly and quickly as possible. And if you're just starting to figure out your gut health, we have a free low FODMAP food list that's ideal for those with diverticulitis, as well as other diverticulitis tips. That's the second link in the description below. Warning sign number 4, urinary symptoms that fool everyone, including doctors. Now, this might surprise you, but diverticulitis can cause urinary symptoms that are often mistaken for a urinary tract infection or UTI. Now, here's why. Your sigmoid colon sits very close to your bladder. When diverticular sacs become inflamed and swollen, they can actually push against the bladder and cause symptoms like painful urination, frequency, and urgency. But in more serious cases, something called a fistula can form. That's an abnormal connection between the colon and the bladder. One patient shared their experience. I had none of the usual symptoms until the fistula had broken out and made my bowel join with my bladder. My first sign was air bubbles when I was urinating, and I experienced a burning feeling. The danger signs to watch out for include pneumaturia, which is the air bubbles in urine, fecal uria, which is feces appearing in your urine, and recurrent UTIs if that person does have known diverticular disease issues. The key point is that if you have urinary symptoms combined with abdominal pain, don't assume it's just a UTI, especially if you've had digestive issues or diverticulitis before. Warning sign number 5, pain in unexpected places. Now, this might sound strange, but diverticulitis can cause pain in places that seem to have nothing to do with your gut. So one patient described their experience. I get what feels like pain in my groin, hip, or my upper thigh. As a teen, I used to get this when I had bad menstrual cramps. That comparison to menstrual pain is actually quite telling. Both involve inflammation that can affect the same nerve pathways. But it gets even more unusual. Another patient shared, in a flare-up, my symptoms are cold hands and generally a panicky feeling with a tight chest. Also, my left leg feels numb, same side as the diverticulitis. Now, you might think that sounds impossible. How can a colon problem cause chest tightness and leg numbness? But here's what's happening. When you have significant inflammation in your body, it triggers a systemic response. Your nervous system can interpret and refer this inflammation to other areas, sometimes mimicking anxiety symptoms, or even heart problems. This is why diverticulitis often gets mistaken for completely different conditions, like kidney stones, I've been told by a couple of patients who were mistakenly diagnosed. And women, especially being told their pain was gynecological, ovarian cysts, endometriosis, even just menstrual cramps, when it was actually diverticulitis. The important thing is to understand that when you have multiple unexplained symptoms happening together, abdominal pain plus unusual sensations in other parts of your body, it might all be connected to the same inflammatory process that's happening in your gut. Warning sign number 6, atypical presentations in different age groups. Diverticulitis doesn't always present the same way across different age groups. In older adults, research shows that it often presents with systemic symptoms without obvious localized pain. So instead of the classic left side pain, elderly patients might present more with fatigue, fainting episodes, or even acute kidney problems. It's why this 2025 study concluded CT imaging should be considered in any patient over 65 suspected of having diverticulitis and presenting with systemic signs or atypical symptoms such as fatigue, syncope, and/or acute kidney injury. Now, on the other end of the spectrum, about half of diverticulitis cases now occur in people under the age of 50, as it's becoming more and more common, but these younger patients often face skepticism from healthcare providers. The concerning part is young patients are actually twice as likely to be misdiagnosed, yet they often have more aggressive disease requiring surgical intervention more frequently than older patients. But perhaps most dangerous are the cases that don't hurt much at all. Remember, one patient said, the 2 times I'd confirmed diverticulitis with a CT scan, I never had what I would consider lots of pain. I felt uncomfortable, like in my gut, but that's it. And this illustrates that some cases present as a dull, persistent discomfort rather than severe pain, which can delay people from seeking care. And when has anyone ever said they were happy that they delayed seeking care? Warning sign number 7, persistent bloating and gas that won't resolve. This warning sign is one that many people dismiss, but it shouldn't be overlooked, especially when it occurs alongside other symptoms that we've discussed. So persistent bloating and trapped gas are actually quite common in diverticulitis, but they're often written off as just IBS or normal digestive issues, which delay proper diagnosis and treatment. And what makes this different from regular bloating is the pattern. So with diverticulitis, patients often describe feeling like they can't pass gas at all, or in regular terms, not being able to fart. This inability to pass gas during flares is actually quite common and ties in with the bloating and partial blockage that can occur. The bloating also tends to be more severe and localized, so in one place. Many patients report that their lower abdomen feels distended and tended to touch, not just generally bloated like you might after a large meal. Here's what's important to understand. Bloating and gas issues are symptoms of many digestive conditions, including IBS, of course. But when bloating is persistent, doesn't respond to usual remedies, and especially when it's combined with other warning signs that we've covered, like left side pain, low-grade fever, changes in bowel habits, that's when it becomes more concerning. The key is recognizing when bloating isn't just bloating anymore. Ultimately, the point of this video was to make sure that you know that if something doesn't add up to you with symptoms, to get a thorough workup with your doctor. Don't accept that it's probably just IBS if you have multiple warning signs. And if I've missed anything, please share it in the comments. And for those who've already been diagnosed, I think just learning to recognize symptoms can be transformative on your journey with this condition. So I hope this was helpful. And while the symptoms can be frightening, I think understanding what's happening in your body empowers you to take appropriate action at the right time. If you're worried about diverticulitis returning, or you don't feel confident in managing it, I want you to know that you don't have to navigate this alone. We've helped thousands of people get real clarity on what's happening with their gut and create a personalized plan to address it. If you'd like that kind of personalized guidance, comment Sure Pathway below, or tap the first link in the description to learn more about our signature For Sure Pathway. It's how we provide concierge, one-to-one help to resolve digestive issues like diverticulitis as smoothly and quickly as possible. And if you're just starting to figure out your gut health, we have a free low FODMAP food list that's ideal for those with diverticulitis. That's the second link in the description. Thank you for watching, and don't forget to like this video and subscribe to the channel for more evidence-based gut health content. And if you want to learn more about getting to the root cause of what caused your gut issues in the first place, I recommend you watch this next video on the screen.